As I said, we're going to talk about IV vitamin therapy today. My name is Dr. Delilah Renegar. Before we dive into all the goodies, I'd like to talk to you and give you an idea of who we are and who I am as we talk about this today and spend about a half hour together. For those of you who are not familiar with Aligned Modern Health, we are an integrative, collaborative group of providers that are practicing medicine in the Chicagoland area. We have chiropractic physical medicine under our roof with active rehab. We have acupuncture. We have functional medicine, which I'm a part of, and clinical nutrition. And we also have clinical massage or myofascial work, as they call it. All of this is under one roof. We all work together for our patients' good. And you may, for your journey with us, you may be seeing multiple providers as you get the care you need. So it's wonderful because, again, under our roof, we talk to each other. We collaborate on our patients' care so they can have what they need, regardless of what practice line that might need to be used. As for me, I'm Dr. Delilah Renegar, and it's my absolute pleasure to be here today. I am a functional medicine provider. I'm the medical director at Aligned Modern Health. I've been with Aligned almost 5 years. I'm very excited about that. I have had that privilege. And I've been practicing this medicine for about 37 years. So I'm really tickled to spend some time with you all today. You can see the background there. I'll let you take a look at that yourself. Just suffice it to say that I love the clinical aspect of patient care. So what is IV vitamin therapy? You can hardly turn a corner without possibly running into someone talking about it or seeing an advertisement for it. And it might even seem like it's kind of come out of nowhere. It's not the case. It's been around for quite some time. And basically what it is, in a nutshell, it's a intravenous infusion or an intramuscular injection. And what it is a combination of vitamins and minerals, amino acids that are introduced directly into the body, either through the bloodstream or again through that muscle. And this allows it to bypass the digestive system. And that's the roadblock that we have for absorption. So when you do it directly into the blood, we get greater benefit. We'll talk about that. So why would you necessarily want to do it? Well, that's what we're going to really dive into. But just to know, if you suffer from stress or you have dealt with poor diet, malabsorption issues, overexertion, or even chronic illness, and I will tell you, coming through this winter, it just seemed like some folks could not get off of that, sick every few weeks. These are ideal candidates for an IV vitamin therapy. I put on here 99% absorption. When we bypass the GI and we go straight to the bloodstream, basically it's 100% absorption. I'm going to tell you that. But I said, let's make it 99%, just in case, just for those people who are very particular. So 99%. So when you get it through that bloodstream, it's not having to go through the inability of, if you've got digestive issues, to be malabsorbed. You don't have to worry about losing any of it. You're going to get the full bang for what you're putting in. And that is, I think one of the big keys. The other really great piece of this is when you talk to your provider about it, we can customize for what your individual needs might be and what your individual goals might be. Again, you may not be dealing with all of these things on the list. You may have a particular, and we even titled this presentation, winter and athletes, and is it for you? And absolutely. So if you're an athlete and you've got endurance, events, or you're trying to train, we can customize things for you. So that's really the beauty of IV therapy: absorption and tailoring it to be exactly what you need. The other part that's pretty cool is IV is an expense that's allowed under most flex spending. So for you folks thinking about it, you can give us a call and check out your flex spending benefits for that. So what is in that IV drip? I just mentioned that it can be customized. Here at Aligned Modern Health, we prepare the infusion each day. They are prepared for the person to order. They have a very high quality list of ingredients. They're made in the United States. They are regulated by a US pharmacy, and they might contain magnesium, B vitamins, your vitamin C, zinc, and a whole group of aminos. Again, depending on what we're trying to accomplish, there can be a grouping and, of course, different ratios of these IV ingredients, again, depending on what we're trying to accomplish. Always, when we put forth a treatment, we want to know its safety and efficacy. And yes, in a nutshell, are IV treatments safe? They're safe, they're effective, and again, they're a much better way to deliver nutrients and fluids directly into that bloodstream, again, bypassing that difficulty in the digestion for a lot of people. Are there any kind of side effects? There can be a few, and it's an interesting thing. Sometimes the more you need it, we'll know, because you might have what we consider very mild. You might literally have a little bit of stomach, and I won't even say nausea because that's not even the right word for it, but you might have a little bit of a stomach upset. Typically very mild, and it usually disappears within about a day. You could also have, it isn't an IV, so you could have a little bit of swelling or bruising at the IV site. We do have a great provider who is in charge of all of that, and they will go through all of those questions before you get started to make sure that you know and have all the information you want before you start. This is the $1 million question. How long do these great effects last? Because again, when you are deficient, whether it be in nutrients or fluid, and you need these, the amount of time the effect will last really is patient dependent. We can tell you that patients can feel the effects sometimes immediately, and it might sometimes take about a day for them to notice. We have folks who notice the effects last for 2 or 3 weeks. And then those who might really be depleted and might need more, they might only feel that benefit for a week or so. But that tells us something. That tells us something that maybe you really have been a desert, and maybe you are more depleted than you realize, again, especially coming out of this winter. So those are all pieces of information that you and your provider, or you and our IV provider, can talk about to see what would be the next best step for you. What can it help with? Immune function. Let's start there. When you look at the ingredients in the IV catalog, you're going to notice there are duplications. We talk a lot about vitamin C. We talk a lot about B vitamins. We talk about the aminos, and of course, fluid. You need these fluids to help. And if you're a coffee drinker or a caffeine consumer, you are probably dehydrated. If you have forced air heating, you are probably dehydrated. We notice when we sweat, of course, in the summer, and you think about dehydration. In the wintertime, you actually lose it through breathing. So you might not realize it. But if you're having to put lotion on your hands because your skin's feeling dry, or your nasal passages are dry, you probably are dehydrated and need fluid. What's this got to do with immune function? With immune function, it is supported through fluid consumption, your vitamins. It helps keep you in the ability to fight those things that come down the pipe. If you have just come off a winter where you are really, again, whether it was the flu or you had COVID or RSV or any of those other just, yucks that were going around this winter, you have depleted your immune fighting warriors, I call them, and the IV can help you replenish your army so you're ready to tackle the next thing. GI concerns and nutrient depletion and malabsorption. So if you've got a GI system that might not be functioning like it should be, you might already know you suffer from IBS or inflammatory bowel disease. You might have short bowel disease. There's all sorts of reasons why you may not digest and absorb the nutrients as you're eating them as well as you should, leading to an ongoing nutrient depletion. So if you're not doing things to counteract that, you're always running at a deficit. By doing IV, you're getting it in and bypassing this system and getting full benefit of what maybe you think you're getting orally. And you might be getting some of it orally, but of course the problem is you're not getting as much as you think, and you don't know how much you may be depleted. We obviously, by the way, we can check those things. That's something you would want to talk to your provider about, especially those of you who are in the AMH family and community already. That is something you can talk to your provider about. But these are the reasons why we know IV therapy is such a benefit. When we get into the metabolism, the dehydration, and now athletic performance and recovery, they really all three go together. Let me be really clear. Nothing works well in a dehydrated system. Nothing. You just have to know that the body has to have a certain amount of liquid compared to the salts and the amino acids and all the other things that we need. And if you're in an imbalance, everything is running in a compromised situation. It's no secret. Sometimes people can get dehydrated to the point where they end up in an ER needing hydration. And that's not, we don't want it to ever get that far. But again, that's not, people don't even realize they're that dehydrated and they've gotten that far. So athletic performance and recovery, we need the nutrients that you have just burned up and utilized in your workout. When you do your training, if you're working your muscles, as you all know, not only are you burning those nutrients to do the training, but micro injury, micro traumas are occurring, and you need nutrients to heal those micro damages, those micro injuries. If you don't, it's very common to end up with a macro injury, something very significant. So this is something that can continue to help you recover, not just in, oh my goodness, I feel great and I have energy, but actually in the healing of the ongoing micro trauma that might be occurring while you're doing your training. Metabolism. There is not a doc or a healthcare provider in the world that won't tell you that metabolism is dependent on hydration. It's how it works. Anyone who starts that January 1, diet for the new year, what's the first thing they say? You've got to drink water. You have to add water too. The problem is, for those folks who haven't been drinking a lot of water, it's a little bit like being in the desert. If you've ever been out there and you pour water on the hard packed dirt, it runs off. You don't absorb it. So this is a way to get that fluid in that you need without it running off like you would if it was in the desert, particularly if you've been dehydrated or even partially dehydrated for a while. I grew up in Florida, and we were very conscious of the summers as a kid working outside, and your sweat and your salts pouring out of you and what have you. You were very careful because it could literally, you could get dehydrated in a day. We don't think about that because, again, we might not be under the hot blistering sun, but again, forced heat, drinking the coffees and the caffeine consumption day in, day out, that eventually adds up. And that's where that dehydration can come into. Fatigue. That's probably one of the bigger reasons why folks come and talk about IV. I'm just plumb tired. What in the heck's going on? Again, if you're dehydrated, that's going to contribute to fatigue. If you are nutrient deficient, your body cannot recover and it can't get you back up to just even neutral. You're always running at that deficit, and it's like any kind of machine. If you're running at that deficit, you are not going to get to a point where you're going to get out of it. You again, and how do we typically treat fatigue now or self-treat? You go down to your corner and you get the venti or the grande or what have you of some sort of caffeinated beverage. That's the band-aid, but it keeps you in this cycle of continued fatigue. Burnout, burnout is different for everyone, but I think burnout, we think of more of a mental situation, but I will tell you that is distinctly driven by your physical. And that again comes back to being dehydrated. If you're being fatigued, you don't have that mental capacity, that awareness. And for those of you who have been in the AMH community and have listened to other digital docs, and if you hadn't, I encourage you to jump in and watch them. But when we talk about gastrointestinal, we talk about the digestive system, that really runs the brain. So again, I go back to, if we're having difficulty there, it's going to contribute to that mental burnout if you're already dehydrated and nutrient deficient. As you can see, this really starts to layer on and layer on. Mitochondria. If you're not familiar, mitochondria is what we call the powerhouse. It's literally the power generator in your cells. And mitochondria are a very important living, breathing. To give you an example, diabetics, if you are uncontrolled and the longer you have it, you tend to lose some of your mitochondria. So you're not burning that fuel in your cell as well. Well, you don't burn that fuel either very well if you're nutrient deficient or you are dehydrated. So it's really important, and we want to keep this power generator always working. And mitochondria is an critically important piece for that. If you don't have that working well, fatigue, not getting as much out of your workout. So if you're going to the gym and you think, man, I'm not increasing my strength, I'm not able to increase the weight that I'm trying to learn, to lift, and I'm not getting to my goal, that is something you want to think about, that you may be, again, nutrient and fluid deficient, and IV can support that for you. And then lastly, the hormone and PMS field, and I'm going to talk in here, memory and brain function. The reason why those are grouped together, because they're so intricately linked. All of our hormones, whether it be thyroid, whether it be male or female hormones, all play a role in how our brain and memory work. And if any one of that in the pathway is disturbed, that's how it can manifest. And again, these functions are dependent on the B vitamins, the vitamin C, the zinc, the, excuse me, the amino acids, and the liquid that it needs to make that transportation. So all of these pieces are really very dependent. And if you have any reason, again, overexertion, stress, you go through these much quicker when you're under stress. If you're not sleeping well, all those things contribute to that nutrient deficiency and lack of recovery. So it's pretty exciting in my world that we can address so many things in basically a bag of IV. So that's pretty cool. That's pretty cool. So let me share some of the very particulars. These are our offerings and what we talk about. Before we dive into these, I want to point something out that I've been fascinated with since my first day of school so many years ago. in the healthcare world. All of our tissue in our body is derived from 3 types of tissue. I don't care if we're talking brain or skin or heart or GI or joint. They come from either what we call endoderm, mesoderm, or ectoderm. And if you think about it, it's brilliant, because when we go to repair something, if we all started out with the same or groups of that same tissue, then what repairs it in one area repairs it in another. So why I'm mentioning this is you're going to see a lot of overlap in different ingredients doing different things. And the reason is because, again, if B vitamins are important for hydration, they're also going to be important for brain boost. And part of that reason is because of that commonality of where those cells started from. And I think it's brilliant when you think about that. It really does, kind of cut back on all the tools you need to get things addressed and fixed. So let's talk about water me, or our hydration therapy. Just as it sounds, this is really for that refreshment and rejuvenation for you. We're talking about getting you hydrated. And again, it's going to be good for GI health. It's going to be those of you who just got over the flu or the stomach bug or food poisoning. Unfortunately, I experienced that in November. And one of the things that got me right back on track was IV therapy, getting those nutrients in as quickly and as appropriately as possible. Whether you got the cold, fever dehydrates. That's one of the ways it works, but it does dehydrate you. Nausea, exhaustion, again, excessive exercise, anything that maybe, again, we think about sweating, but I also want to talk about that forced heat, all of those things. And so it's, again, a C grouping, a B vitamin grouping, and minerals to hydrate you. Energy. Lo and behold, we have B complex and amino acids, because these things are what support our metabolism. They actually help reduce food cravings, because, again, oftentimes you're craving things because your body's trying to tell you you're shorting yourself on possibly a nutrient. So this will help with that. And stress relief. The neurotransmitters and the hormones that the body needs to combat and modulate your stress response is what you will find in this recharge and energy boost. So again, metabolism, energy, and stress relief. You cannot go wrong. Immune, lo and behold, again, the building blocks with the B vitamins, the vitamin C, and zinc is a big one. All of these together are anti-inflammatory. They're great for wound healing. If you lost your sense of taste and smell, particularly, obviously, we dealt with that through COVID, or that is something that happens as we age. It's not a product of aging per se. It's a product of low zinc. And it's great. I have to tell you, it's one of the greatest things when someone comes in, they get the treatment and they come back and say, I didn't realize I couldn't taste my food. I cannot tell you how great it tastes now. It's really delightful because, obviously that's something that brings great pleasure to many people. And if you can't taste it and enjoy it, that kind of stinks. So it's really, really nice to have that. And again, someone who's battling chronic infections, or you've got an immune compromise that might be at on here too. And I like to point this out. It talks about collagen promotion. Collagen is connective tissue. It's in our heart, it's in our eyes, it's in our sinuses, it's in our lungs, it's in our skin, it's in our joints. Collagen is a connective tissue that's a lot of places. Vitamin C, B vitamins, and zinc very much support that repair. Your arterioles in your veins. Vitamin C is very important for their integrity. So even though we talk about immune, these benefits really do spill over into other areas of the body that the list just becomes too long really to talk about. but I did want to point that out because collagen is really a key there. And the other part that collagen you may be familiar with is in skin. It helps keep the skin tight and looking nice. And anti-aging, I understand that the term, I just want to say glorious for wherever you are and whatever age you are. And that collagen promotion helps that. Brain boost. If this isn't probably one of the most requested things, is how do I get my focus back? How do I get my memory back, my cognition? And the brain boost is designed to do that, particularly with B6, the amino acid taurine, and alpha lipoic acid, which is a very strong antioxidant. And all of these, when we say antioxidant, that countering free radicals, that's what it does. An antioxidant comes in and corrals up those free radicals, and free radicals are what does the damage. So all of these are to sharpen and enhance your cognitive ability. Myers cocktail, probably one of the more commonly known IV therapies, and it has many applications. Healing and supporting is what we talk about, but it can be used with asthma. It can be used for anything that needs an anti-inflammatory. So I'll just stop right there. And I want you to think about any time you would take an over-the-counter anti-inflammatory, you could do a Myers cocktail instead and get longer benefit and begin to start possibly that anti-inflammatory and that repair. Allergies, sinus conditions, again, nutrient deficiency for whatever reason. And again, if you're taking an antacid, you are reducing stomach acid in the long run. Myers cocktail would be someone. So if you're having to take an antacid, consider this one. If you're taking an anti-inflammatory over the counter, consider this one. If you've dealt with, again, pain, asthma, any of those groupings, Myers cocktail, it's made up of magnesium. It's got chloride in your B complex, your B12, calcium gluconate, which is a very nice, not only antioxidant, but it's very strong in the liver support and remember, liver is designed to take anything you take in and make it, basically detoxify it. And calcium gluconate supports that process. And then of course, vitamin C, because vitamin C is just incredible for what it does. Linus Pauling dedicated his life to what vitamin C brings to the table. Athletic performance and recovery. The real kicker here is almost every cocktail that I've talked about so far, every IV infusion would enhance an athletic performance and recovery as well. This one in particular has the amino and mineral blend for that nutrient replenishment and recovery, and it's at a level for that athlete. So I just want to let you know, when you look at it, it can be used for all of these things: energy, digestion, brain, metabolism, but it's designed to give that athlete who's doing that micro trauma, doing that nutrient depletion, it's designed to get them back in the game as quickly as possible and continue to heal up those micro traumas. Metabolic reset. This is one that I want to be really careful how I talk about this for a couple health reasons and clinically. If you watch or follow anything with Google or any of the ads on January, everybody talks about weight loss. What we need to know about weight is a symptom. Weight is a product of something gone awry, and we're learning more and more and more about that. So what you want to do is not necessarily diet. We want you to eat healthy, but we want to reset the metabolism, because we do have, and if you've been someone who's been a yo-yo dieter in the past, we know, and literally the research is wild about it. It's kind of cool. but it's showing about a 300 calorie drop. So we need to reset that metabolism so you don't have that. Because again, how many folks are like, I hardly eat, I skip meals, I do this, I do that, and yet I can't move the scale. I'm not so much worried about the number as I am concerned about the healthy eating. We want that. We want you to be getting the nutrients and what you need. But at the same time, the vitamin, the L-taurine, methyl B12 in particular, actually helps reset your metabolism and helps undo those years of yo-yo dieting. And raising that metabolism is what will allow you in a very safe, appropriate, healthy way to maybe get to a healthier position. And again, I don't even talk about numbers. I'm talking about how you feel, how you're able to function, how you're able to move. But increasing metabolic is a big part of that. And you're going to hear more and more. The other term is the body does metabolic adaptation, and that's why that set point can get lower. Metabolic reset, it's our way to fight that. Alleviate is for pain relief, and we particularly talk about PMS because if you are someone who has suffered from PMS, that can be debilitating, and this is very effective to address that for us. So it can be for any pain, but we really want to highlight the PMS aspect of it. Again, calcium chloride, B12, magnesium, and B complex are all things that address that change in hormone, that PMS time of our cycle where it's very uncomfortable. This actually helps us to address it, and it re-regulates the body so you're not suffering from that. Glow up and beauty. If you notice here, we talk about healthy skin, hair, nails, skin damage, stress, energy, metabolism, low NAD, which is a particular type of it's cofactor for a great deal of enzymes for metabolism, for immune process. So you make it with a couple of amino acids in particular, and this actually helps your body make it. So it has far-reaching impact, not just beauty. It's liver and kidney support, heart, and autoimmune. Now, the interesting thing, and I mentioned it earlier, and this is a perfect example. When we talk about skin, we talk about collagen, and we're talking about supporting that with the biotin, the other B complex, and vitamin C. We really are supporting that connective tissue, and connective tissue is everywhere. So you may notice it with skin that's glowing and you feel very rejuvenated in that regard. I'm actually happy because I know that same rejuvenation and radiation is happening in all the rest of the parts of the body, and that's a really, really big deal. That's the combination of the person's happy because they feel like they're radiating, glowing, and then we're happy because we know it's also benefiting their organ systems. You also always have the option you can talk to our provider when you're coming in, or the provider who you may be meeting with. But there are add-ons depending on your need. This is how we can help customize an IV infusion to what your needs and what your health concerns might be. So this would be something that I always would encourage you to talk to the provider. If you are calling us for the first time and you've not been, make the appointment, talk with our IV provider. Melissa, she's terrific. We have a team, and she will help guide you on what your best options are if you're not totally sure when you come in. And then we'll prepare it. She can make it right then and there and get you taken care of. So I always want to make sure that I let you know that I appreciate that you've just spent about the last 45 minutes with us. I hope that you have taken away some very valuable information, and that this is something that if you believe will serve you, to please give us a call, let us know. This particular slide I'm very proud to talk about Aligned Modern Health. We're in network with Blue Cross Blue Shield and Aetna for our physical medicine team, acupuncture, our functional medicine and nutrition. We also serve the VA and we serve those who have served, and that's also something I'm very proud of. We are in United Healthcare as well for both chiropractic, physical medicine, and acupuncture. We're in Cigna, so that's a very cool thing. And our chiropractic, like I said, physical medicine is also Medicare participating. So if you have any questions, let us know. We talk about all of this because of how it may benefit you, and I hope you'll take advantage of that. February is self-love, self-care. Through the end of February, if you call to get in and get an IV, we're offering 30% off any single visit IV treatment at Aligned Modern Health. Just give us a call about that. I do have some questions. Thank you. What locations have IV therapy? Currently, our locations are Logan Square and Elmhurst. So if you give those locations a call, you can get in there. And I'm looking forward to being able to tell you more to come, more locations to follow currently right now, Elmhurst and Logan Square. So suburban, we got you covered. City, we got you covered. Thank you for this question. Is there any testing nutritionally or otherwise that might help decide if this treatment is a good option? Yes, there is. Thank you for the question. We do, there are several names for it, but bottom line, we actually can do a nutrition evaluation on you through your blood that will tell us what your B levels are, if you are showing deficits in other vitamins and nutrients, if we've got a protein deficit, what your omegas look like, which is the fat side of the, fat, protein, and carb. So yes, there is, and you can talk to your provider. If you don't have one, please feel free to call. We also offer 15-minute consultations that allow you to talk to a provider to see if it's a good fit. And we're happy to do this because some of this is new to folks, and we always want to make sure that you get your questions answered. My pleasure. Thank you. Minnesota location. Oh my goodness. We do remote. And Janine, help me here. Everybody knows that there's always a great person in the back helping me out. Janine, I do believe we have providers remotely that cover Minnesota. We've just expanded so much. I want to make sure I don't misquote, but
yes, I believe that is correct, Dr. Renegar. So we offer telemedicine services. Unfortunately, we cannot offer an IV therapy treatment via Zoom. However, we can work with you to help you determine a facility in your area if that is something that's indicated as part of a treatment plan.
Yeah. And just so you know, when we do remote, we do know in the states we're in, we can refer. We have a network of folks we work with. So if you did an IV, we can help you get the proper place in Minnesota. So it's all about getting you the care you need. Thank you very much. Our pleasure today. This has been wonderful. Janine, I just want to say thank you for your help, and have a great rest of your day, everyone. Thank you for joining us here at Aligned Modern Health.